Today, I'll be talking to you about Lassa fever and what you should know about this disease. This Lassa fever is an acute viral hemorrhagic fever. Hemorrhagic because it breaks down blood vessels and cause bleeding and impair blood clotting. So there will be bleeding, excessive bleeding. So that's why it's called hemorrhagic fever. And so this Lassa fever is caused by a virus called Lassa virus in the family Arenaviridae. But I will not bore you with the microbiology of this virus. So this Lassa fever is carried by a multimammate rat called Mastomys natalensis. Is a mammal, a rodent, a rat that has uh, multiple mammary glands, and it is common in West Africa. Also in Nigeria, you can find it and in houses and bushes. This Lassa fever can be transmitted directly through the contact with the urine, the blood, the feces of this mammal, of this rat. And also it can be transmitted indirectly through the contamination of food containing this the urine, either the urine, the feces, the saliva of this rat, or any household equipment that has come in contact with these infected materials. So one can be infected through this. Also, nosocomial transmission can occur, which means that is a transmission that occurs in the hospital. When you go to the hospital, you can contract this disease due to maybe the reuse of syringe or other contaminated medical equipment. Person to person transmission can occur by coming in contact with the bodily fluid of infected individuals, like the blood, the saliva, the urine of such individuals. You can contact this Lassa virus from that way. Also in humans, incubation period is from 6 to 21 days, and the clinical signs will start like just like malaria. You will notice clinical signs like muscle ache, sore throat, vomiting, diarrhea, abdominal pain, chest pain, fever. Then in the severe cases, you will see you will notice bleeding from all the orifices like the mouth, the eyes, the ears, the nose, the anus, the vagina. Anyway, in this severe case also, there will be facial swelling, tremor, fluid in the lung cavity, coma, and also death can occur. Deafness can also occur in some patients that survive this disease. So this disease is a very deadly and terrible disease. You have to be careful and make sure you stay safe. In Nigeria, this disease has been recorded in Benue State, Plateau State, Taraba State, Ondo State. When you notice any of these signs, you have to go to the hospital. Medical professionals are meant to use personal protective equipment to avoid themselves from being infected. Number one, use rodenticide to kill all forms of rodents and rats in your house and in the vicinity. Stop drying your food items. Leave your food items in the open because rats can come and defecate on such food items. Then put your food items in a container and seal it up so that rats won't have access to those food items. If you want to use can or any canned drink or canned food, you have to wash them properly before you use. Public awareness is also very important. The public needs to be educated on this disease. Infected patients should be isolated and treated immediately. Healthcare workers should take precaution to prevent the transmission of this disease in the hospital. If you find this video helpful, leave a comment, like, subscribe, and follow for more educational content like this. See you.